My name is Ralf Süthoff from the Center of Humanitarian Action. But before we start, we will be happy to share with you quickly some housekeeping and even more importantly, some ways how to access this event, which is more important than in other events before. We hosted for us as CHA, it's the first time we are hosting an event with full access. We hope so. There is a lot to learn for us as well, and please bear with us in case there might be one or two hiccups. So maybe we can jointly look in the first place at some housekeeping and access opportunities. We will hope to discuss with you this important topic for the next 1.5 hours. Please don't turn on your video and unmute yourself unless you are a panelist or play another translating role in our event. And you can engage in the whole event in the chat. We hope that's okay for most of you, so we can only deal with this in English and writing, unfortunately, but we hope this is a channel most of you can participate. How to access our event? There are a couple of ways and opportunities, and many of you have already indicated which way you want to join when registering. Just to recap, there will be an English live captioning. Subtitles are available. If you click on the CC button in the Zoom menu, and to access the full transcript, please use an external web browser linked to the live chat. There is, as we will have a really international panel today, Arabic, English simultaneous interpretation available. If needed, please change the audio track in the Zoom menu at the very right bottom in the right-hand corner of your Zoom view, I hope. And there is international sign interpretation also available, as you can hopefully see already right now. Joining us with 2 colleagues. The video will be pinned automatically. We hope that's already accessible to all of you. Important to note also that the event will be recorded and shared shortly after the conference on our website. And also for a quick summary for everybody who can't or doesn't like to watch the full video, a perfect recording will also be shared after the event. As this is a complex setup with many people playing a role, I've never tested so much with so many people ahead of an event. So I hope all is fine, but if you have any technical issues, please don't hesitate to send a private message either to us in the chat, addressing the JAR technical support, or just traditionally write an email, or you can also call us if you use the mobile number. I can read it to you as well. That's 0049 159 0681 8524. I repeat that. German code +49 159 0681 8524, or mail to us at info@charberlin.org. Many thanks for joining us. I hope this has been all clear, and you all can join us either way you prefer, as that would be really much appreciated, as we really have an international panel. I quickly will share with you the outline on this important topic we will discuss today with 3 colleagues, starting in a minute with Gulnaz Ibrahim. She's Ambassador for Humanity and Inclusion based in Syria. We will talk to Ibrahim Khan, Emergency Programs Coordinator of Mercy Corps, and Davide Amouri, the Deputy Manager of the Syria Cross-Border Humanitarian Fund, working for OCHA. My name is Ralf Süthoff. I am the Director of Germany's first think tank for humanitarian aid, the Center for Humanitarian Action, and I'm really honored to host this because, for one, I have a personal attached to any topics related to Syria. As in my former life with the UN World Food Programme, I've been the head of the regional office dealing with Syria crisis in Jordan. And from this experience, I might say, indeed, a frank and honest discussion is needed on inclusion, as I might say that I'm impressed until today, on one hand, what agencies achieve and can do to save millions of lives and supporting millions of people in Syria and the countries beyond under the most difficult circumstances, while I might also say that I'm not proud at all to share that in my 2 years in the region, 2018, 2017, the issue of inclusion has not crossed me by any internal or external exchange with partners. And that's might underline how important it is that we have a discussion about this right now. It's obvious that this is a shame. The figures speak for themselves, that this is not a minor aspect or some nice to have topic. If we believe in a needs-based humanitarian approach and in the principle of humanity to reach the people according to their needs and the ones who are the neediest, if we only take the example of Syria, which we will discuss today, more than 1 out of 4 Syrians has a disability. If we look at the particularly needy, the displaced Syrians, it's more than every 1/3 of them. While most humanitarian aid, I would claim, is not considering inclusion as a substantial topic, there's evidence for a strong correlation of disability and humanitarian needs. For example, in Syria, needs assessments show that if we look at the most needy households in Syria, most of them have at least 2 disabled people or even more. And the issue goes well beyond Syria crisis. If one would ask in a survey, probably most friends of us would indicate, well, maybe 1, 2, 3% of global population has a disability. In fact, it's more than 50%, as many of you might know. And in our humanitarian world, the figures are, of course, even worse. We talked a lot about Afghanistan, for example, last weeks and months, and a survey indicates after 20 years of war in Afghanistan, 80% of the population has a disability or a chronic illness. At the same time, humanitarian response has lacked for decades a systematic approach to hear disabled people and to integrate them in the response. And so latest research, for example, indicates that's also Rohingya crisis in Bangladesh, highlighting that there is still great challenges in the response. And the chart block we just highlighted can illustrate that if of any interest to you. However, maybe all this is outdated and experience from the past. 2019, the IASC guidelines on inclusion of persons with disabilities in humanitarian action have been approved. And these questions were from your view, we stand with this. We would like to share very quickly a survey with you and everybody who is engaged in humanitarian action. So maybe you can give some feedback to us in which way you think women and children as aid providers and receivers, if you could share with us a question on a quick survey, and we would like to hear you. What is your organization's current stand if you represent an organization? Or if you know one very well, please feel free to answer as well. What is your organization's current stand on inclusive humanitarian action? Do you actively engage persons with disabilities in your response, either as beneficiaries or as actors? So please mark one of the 4 answers. Yes, you believe this is part of it a lot. Yes, only a little. Oh, or no, not at all. Or if you feel like this is nothing you can give a fair judgment on, feel free to cross. I don't know. So maybe we give it a minute so everybody can do the survey in the next maybe 10 seconds. It's not too difficult, I guess, to point this quickly. And then if the colleagues could share the outcome in a second, that would be great. So we all have an impression where we come from. And there you see, where do we stand? How actively do all the agencies present today already engage persons with disabilities? A lot, 38%, which is not too bad, I would say, and a little 58%. So in one way or the other, colleagues have indicated, you have indicated that this is a topic. But for on the other hand, one might say 38% think it's already playing a major role, but more than 60% don't see this so far as handled in a decent way. So against this backdrop, there's apparently much more to do. I would be more than happy to hand over to Pitt Köhler. He's joining us from the German Foreign Office, which is supporting a project by our co-hosts Handicap International, and by that also this event. And I'm sure Pitt Köhler can also share a bit with us why this is such an important topic, as well as which challenges are there still ahead, also if we look at German humanitarian assistance. Over to you. Pitt Köhler is the head of the unit for humanitarian assistance, multilateral organizations and international organizations in the German Federal Foreign Office. Over to you.
Thank you very much, Ralf Süthoff, for the very kind and warm introduction. Ladies and gentlemen, participants, it's a great pleasure to be here. I see that there are more than 70 participants already, so I'm really grateful to be part of this discussion and to deliver a few opening remarks. Having said that, of course, my big thanks goes to Handicap International and the CHA as the organizers of today's meeting. But I would also like to thank Handicap's partners in the project that made today's event possible, the Christopher Blinden Mission and the Ruhr University in Bochum. As Ralf Süthoff has already indicated, Germany is a proud and strong supporter of the IASC guidelines on inclusion of persons with disabilities in humanitarian action, but also more in general of including persons with disabilities in humanitarian assistance. And of course, we will remain committed to supporting disability inclusion in humanitarian assistance worldwide. That is why events like the one today are very useful to raise attention to the guidelines. So why is disability inclusion in humanitarian action so important? Why should we care? Let me start with the numbers, but Ralf Süthoff has already mentioned some of them. It's 15% of the world's population that has some form of disability. In total, that means over 1.1 billion people. And as we have heard, in crisis contexts as Syria, the numbers are even higher. So as persons with disabilities are still substantially neglected when we address humanitarian crises, we still do have a lot of work to do. So please allow me to quickly highlight 4 ways to address their needs in humanitarian situations. The first one is on meaningful participation. Humanitarian, development, and peace actors need to ensure that persons with disabilities are included in every step of all projects, from planning to implementation to evaluation. That is why we already require from all our implementing partners an analysis of the needs of persons with disabilities. We have introduced a gender-age disability marker to ensure that they are included in all aspects of a project. However, we see in practice that disability is often the least considered aspect. So ourselves too, we can still improve the work that we do with the inclusion of persons with disabilities. Only when persons with disabilities are included in the design of projects can their specific needs be addressed and helped in a meaningful way. An important aspect here is localization. People on the ground often know best what is needed. I therefore urge all humanitarian partners to listen to them, hear them, and work with them. The second point is on the removal of barriers. One of the biggest hindrances, of course, obviously, are barriers. Walking to a specific place to receive food and water seems doable unless you can't walk or you are using a wheelchair. An online reporting mechanism seems easy unless you can't see properly or you can't type. Consequently, we need to find a way to remove these barriers, or at least make them more visible. That is why things like the IASC guidelines are so important. They force us to review our current mechanisms, our procedures, find new and innovative ways to include the largest amount of people we possibly can. This event is a great example for doing so. There are simultaneous translations into international sign language, and translations into text to ensure that the greatest number of people can be reached and can participate. And the third point is on the need for disaggregate data for monitoring inclusion. So this point is probably the one we least need to explain. Disaggregated data is one of the most crucial aspects of inclusion. Without accurate numbers, how would we know who to include? How could we deliver the right kind of humanitarian assistance? It's simple, we couldn't. We need accurate, timely data. That is why the disaggregation of data is the first and most important part of our gender age disability marker. And my fourth point, we need to empower persons with disabilities. We need to support them. We need humanitarian actors to develop their capacities. It is not only enough to ensure we have the technical capabilities to include persons with disabilities. We also need to empower them, and we need to ensure that humanitarian actors include their voices and to develop their capacities. Only when people feel they have a voice and they are being heard, they will be empowered. In conclusion, ladies and gentlemen, let me reiterate, Germany is and will remain a strong supporter of disability rights and inclusion in humanitarian assistance. We remain strongly committed to supporting the implementation of the IASC guidelines and to help integrate disability inclusion in all aspects of humanitarian assistance. So let us do everything that the guidelines become a living, breathing instrument for inclusion, not just a document sitting on a shelf somewhere. I'm therefore particularly grateful that I have been invited today, and I'm looking forward to a stimulating and fruitful discussion. Thank you very much, and over to you, Ralf Süthoff.
Many thanks, Pit Köhler. Many thanks for so well introducing the topic and putting it into broader contexts like data management, localization, and the overall setup we need to look into. We talk about inclusion as well. Let's now move to somebody who really knows what all this means in Syria. We will be joined by Gulnaz Ibrahim, I already mentioned, from Syria. Gulnaz, you are the ambassador for persons with disabilities in northeast Syria, and you have a very interesting history, which you might share with us in a minute. You are an ambassador with a disability yourself. You have led a life as an orphan for years, but at the same time managed to study Turkish literature, I read, but also vocational rehabilitation for people with disabilities. And I heard you joined also tournaments for weightlifting. So is CV really interesting? At the same time, is CV also affected by the war itself in Syria? If I'm not misled, your leg disability has also been affected by a bombardment, which has been striking you. So you really know what it means to live in a humanitarian crisis with a disability. You know much better than all of us what we are speaking about, and at the same time you engage in a way on this topic where there's surely a lot to learn. So Gulnaz, over to you. You will speak to us in Arabic so everybody can use the simultaneous English translation, and I hope the sound and transfer of all our inputs has been fine as well. Over to you, Gulnaz.
مرحبا، بشكركم كثير على هالدعوة. أنا جلناز إبراهيم من سوريا. أود أن أشارك بعض المعلومات عن وضعي أنا والأشخاص ذوي الإعاقة في شمال شرق سوريا، بالاعتماد على النقاشات التي نجريها بيننا نحن الأشخاص ذوي الإعاقة. بعد 10 سنوات من الحرب لا يزال سكان شمال شرق سوريا يعانون من نقص البيئة التحتية المناسبة والتضخم الاقتصادي الهائل وسوء الوضع الاقتصادي، خاصة بعد الجفاف الذي أصاب المحاصيل هذا العام. لقد عانيت كثيراً في تلبية احتياجاتي الأساسية، خاصة وإن زوجي هو أيضاً شخص من ذوي الإعاقة، ونقص البيئة التحتية القابلة للوصول في أسواقنا والمرافق الصحية والمكاتب العامة ووسائل النقل العام أثرت بشكل كبير على قدراتنا في تلقي احتياجات الأساسية، وهناك حاجة ماسة إلى الخدمات الصحية المناسبة للأشخاص ذوي الإعاقة، لكنها للأسف محدودة للغاية في شمال شرق سوريا، خاصة بعد فيروس كورونا كوفيد-19. عندما ضربت جائحة كوفيد-19 شمال شرق سوريا، عانيت أنا وعائلتي نفسياً، خاصة كأشخاص من ذوي الإعاقة، ولدينا بالفعل الكثير من المشكلات الأساسية، واضطراري لاستخدام الدرابزين أثناء صعود الدرج وملامسة الأسطح، مما يجعلني أكثر تعرضاً للخطر الإصابة بكوفيد-19 مقارنة بالأشخاص الآخرين غير ذوي الإعاقة. ولكن أسوأ عائق واجهته هي العوائق الاجتماعية داخل مجتمعنا، من وصمة عار وتنمر والتمييز، مما يحرمنا من الكثير من حقوقنا الأساسية، مثل مثال الوصول بالتساوي إلى الخدمات المطلوبة، تليها الحواجز البيئية والمؤسسية، حيث كافحت كثيراً بالعثور على وظيفة. خلال ذلك الوقت صادفت منظمة الإنسانية والإدماج، وهي منظمة غير حكومية دولية تعمل في الاستجابة السورية، والتي وفرت فرصاً للرجال والنساء ذوي الإعاقة للتعرف على حقوق الأشخاص ذوي الإعاقة وكيفية زيادة الوعي وتخفيف العوائق بجميع أنواعها وتقليل وصمة العار في مجتمعاتنا. وضمن مقدمي الخدمات مثل منظمات الإنسانية غير الحكومية، نتعلم أيضاً كيف نكون مدافعين عن أنفسنا داخل مجتمعاتنا. إنه مشروع يهدف إلى دعم الأشخاص ذوي الإعاقة في تمكينهم، ويطلق عليها مشروع السفير أمباسادور، ويطلق علينا النساء والرجال ذوي الإعاقة المنخرطين فيها السفراء أمباسادورز، كوني جزء من فريق السفراء مع منظمة الإنسانية والإدماج. كانت هي أهم مرحلة في حياتي، حيث كنت جزء من فريق كامل من الأشخاص ذوي الإعاقة، والمشاركة في التدريب وجلسات التعلم وغيرها من بناء القدرات بشأن حقوق الأشخاص ذوي الإعاقة. أصبحت المدافع عن حقوقي وحقوق الأشخاص ذوي الإعاقة، والتعرف على العوائق والوصول والقدرة على البحث عن التدابير للتخفيف والتعرف على قدراتي، ولأصبح جزءاً من بناء وعي مجتمعي بشأن الدمج. والاستفادة من تجارب السفراء الآخر ساعدني كثيراً في تخفيف الكثير من الحواجز إن منظمات غير الحكومية تميل إلى أن تكون أكثر شمولاً في تقديم المساعدات الإنسانية، وخاصة عندما تقوم بتوظيف الأشخاص ذوي الإعاقة ويطلبون الدعم في بناء القدرات فرقهم حول الدمج. آمل أن أتمكن في المستقبل من رؤية المزيد من التغيير في مناهج المنظمات الغير الحكومية، وأيضاً في وعي المجتمعات، حيث سيستمرون في تمكين الأشخاص ذوي الإعاقة والتأكد من تقديمهم بشكل جيد. عامل التمكين في حياتي هو دعمي لذاتي لنفسي داخل مجتمعي من خلال العمل مع برنامج السفراء. أنا أعمل على زيادة وعي المجتمعات والأشخاص ذوي الإعاقة ومقدم الرعاية لهم بشأن الإدماج وحقوق الأشخاص ذوي الإعاقة، وبالتالي المساعدة في التخفيف من الحواجز الاجتماعية من خلال تقديم مثال حي عني لقدرة الشخص ذوي الإعاقة على العمل وأن يكون شخصاً فعالاً في مجتمعه. لقد تدربت من قبل ريليف على إجراء مناقشات جماعية مركزة، ثم أجريت جلسة نقاش مركزة FGD للنساء ذوات الإعاقة حول العنف القائم على النوع الاجتماعي كجزء من جمع البيانات حول العنف القائم على النوع الاجتماعي. وكان هذا جزءاً من الاحتياجات الإنسانية المرتبط ببرنامج تقييم الاحتياجات الإنسانية (IASC) الذي يجمع البيانات عن حالة السكان ذوي الإعاقة ومن غير ذوي الإعاقة في شمال شرق سوريا. إن الانضمام إلى السفراء يتيح لي رفع صوتي في مجتمعي للدفاع عن حقوق الأشخاص ذوي الإعاقة وتعبئة الأصوات للحصول على حقوقنا في حياة كريمة والاستمرار في العيش بكل قوة. ساعدني العمل مع منظمة الإنسانية والإدماج في تقويتي كشخص وزادت ثقتي بنفسي، مما أدى إلى تناقص العبء النفسي بعد أن أصبحت جزءاً من فريق السفراء أمباسادور الذي يتفهم وضعي والعقبات التي أواجهها لأصبح على ما أنا عليه الآن. العمل مع منظمة الإنسانية والإدماج فتح لي أبواباً جديدة لفهم حقوقي ومعرفة الإدماج، وشعرت دائماً أنني بحاجة إلى القيام بشيء للتغيير واقع الأشخاص ذوي الإعاقة. ولكن الآن مع المعرفة الصحيحة يمكنني أن أرى نفسي أرفع صوتي أكثر من ذلك. أنا مخولة لمطالبة بحقوقي الخاصة في المساواة والوصول العادل إلى الخدمات الإنسانية. شكراً.
Thank you so much, Gulnaz. I hope you can still hear us, and much appreciated your perspective, how the situation is in Syria and for you and the communities there. You indicated that some progress has been made. There is a bigger attention to the issue of inclusion by aid agencies, by other actors in Syria, in northeast Syria, where you are living. Having said that, which challenges would you name? What still lacking? Is there really a systematic approach to include these issues into the humanitarian response, or is there much more needed?
بس لو سمحت فيك تعيد مرة ثانية لأن الصوت ما كان كثير واضح. هذا السؤال.
I'm not sure. Yes, can you still hear us?
Some problems with the Arabic translation. We cannot hear it.
You could not hear my question, so I would repeat the question. We heard there has been some progress made and a bit more attention is paid to the issue of inclusion. But what else is needed? Could you hear me this time and you are translating?
هلا الاحتياجات الأساسية هي إنه تكون في بيئة مناسبة للأشخاص ذوي الإعاقة، تخطي الصعوبات بالمجتمع مثلا من الناحية السلوكية الاجتماعية المؤسساتية. أنا بعتبره هذا أكبر حاجز بيني وبين المجتمع. يعني لما يكون في هالحاجز فرح يكون في صعوبة بالوصول. فلما بدي أتخلص من هالحواجز، لما تتهيأ لي إمكانية الوصول من معدات وأجهزة طرق الوصول بشكل سهل مثلا إلى المدارس أو المؤسسات أو الأسواق أو إلى أي مركز أنا بدي أروح عليه، فرح تكون سهولة الوصول عندما أتخطى الحواجز.
Many thanks for that, and many thanks for now, Gulnaz. We come back to you very soon. Let's maybe for now move on and ask, in the first place, somebody who works for an NGO which tries to follow the guidelines to pay sufficient attention to the issue of inclusion. Ibrahim Kader, I hope you can hear us and you join us from Raqqa. You are the emergency program coordinator of Mercy Corps, Once again, a very interesting CV. We can learn a lot of you for a start to improve our English, as you've been an English teacher for many years. While, if I understand correctly, it's been the Syria war which made you a humanitarian and an expert on these issues, as you have joined 7 years ago Mercy Corps, and today implementing humanitarian aid before from Turkey and now in northeast Syria in a potentially very inclusive way. So can you share us a bit with us your experience, Mercy Corps experiences, the obstacles you faced, and how the inclusive approach has also changed overall the way of humanitarian aid you've provided in the past years? Over to you, Ibrahim.
Hello, everyone, and thank you, Ralph, for this introduction. Yeah, personally, like I went through, I get suffer from the Syrian crisis, which is ongoing till 10 years. I became IDP and we fled to Turkey, we returned back. But during this cause and this mess, like I could find an opportunity to apply to the humanitarian field and to get improved and on it and try to assist the people of my country. Thank you so much again. And today, like I had prepared a presentation from Mercy Corps, as I am working from Mercy Corps side, what Mercy Corps has done in this field, how we get more inclusive. We started, as I said, like in Syrian crisis in emergency activities, but the situation is getting more changeable, so that we adapted our tools and our strategies, and now we become more inclusive. So next slide, please. Next slide. And the next one, please. Thank you. So Mercy Corps has been working in Syria since 2011, and we are divided into 3 hubs. In the north of Syria, Mercy Corps has been working since and indirect programming, protection and social cohesion. Today, we will focus on the emergency teams activities in north of Syria and how over the time we try to become more inclusive of people with disabilities in our programming, how we did it and why we are doing it. Next slide, please. Thank you. In 2018, Mercy Corps was implementing more and more cash-based activities in north of Syria. After the fall of ISIS in Raqqa city, Mercy Corps and HI started implementing in the city. The reality on the ground has shown a high number of victims of a blast injury. To overcome this issue, HI and Mercy Corps designed a joint activity through which HI would refer to Mercy Corps cases of victims of a blast injury who were supported by them with medical assistance, to Mercy Corps to be supported with multi-purpose cash assistance. Our activity continued for 2 years, and in 2020, we were able to get feedback from members and to get some analysis. Based on those, we decided to review our partnership and to go beyond the referral process. A necessary action to improve our partnership was to look at how Mercy Corps was understanding the disability throughout our activities. And that led us in 2021 to review our key tools by HI inclusion team. By the tools, I mean registration tools that enable us to select participants, the post-distribution monitoring tools. For example, we adapted the way we were originally identifying people with disabilities by adapting the Washington group questions. And in parallel, we changed our memorandum of understanding and joint procedures to add more steps throughout the activities life cycle related to inclusion of people with disabilities, such as trainings of Mercy Corps team members.
Can I ask a quick question? What are the Washington Group tools many people might not know?
So, I didn't hear you well.
I'm not sure if you could hear me, just quickly jumping in, because you mentioned the Washington Group tools and some people might not know them. Can you quickly share what that means?
Yeah. So the Washington Group tool is a tool I get. I'm sorry, did you ask me to present it, the tool itself, or?
No, just quickly explaining, if it doesn't take too long, what does it mean using the Washington Group tool? What is it actually for people who are not experts on this?
Yeah. So the Washington Group tool is a tool been released from a group which is called Washington Group, and discussing the difficulties of the peoples with for the people who, especially for the people with disabilities, they might have, which is linked to the vision and hearing, the mobility of these people, the self-care and communication, and how the organization, the humanitarian agencies would deal with these people, because dealing with such sensitive cases in the community would absolutely be different from dealing with the normal people. So a tool has been released and been improved from the Washington Group to be as a guidance to be used by the humanitarian agencies.
Mm-hmm. Please proceed.
Okay, so next slide, please. Thank you. Basically, from working with HI, we progressively went on an inclusion journey. These internal adaptations of tools and the process didn't only apply to our joint MC and HI partnership. We aim to add this inclusive lens to all our programmatic activities within the emergency team, and then to the other Mercy Corps North of Syria departments. This journey takes time, and it is not a one-off thing. It requires to have the right technical advisors to support you. It requires time for a training and all departments or partners buy-in. Next slide. In this table, you can see that what Mercy Corps was already doing before getting closely communicated with the HI organization. During the registration, Mercy Corps would collect sex and age disaggregated data during the registration and PDM process. And during the participant selection, Mercy Corps would looking at the disability status of the household to determine the level of the vulnerability. And during the distribution, the team would do door-to-door distributions, fast lines for the people with disabilities. Next slide, please. And the next slides, we show what additional steps Mercy Corps added to our process since our discussions with HI in 2018. We changed the way identifying participants. Before, we were asking the households respondent whether there were people with disabilities in their households. But now we are asking the head of the household, all the Washington Group questionnaires, and this enables us to avoid asking a sensitive question such as, is there people with disability within your household? And to enlarge the definition of disability that participants might have. this is, as I said, a continuous process that is changing throughout the time. And that was the journey of Mercy Corps, how we started and where we are at now. So thank you so much for listening to me, and I will answer any question you might have.
Many thanks, Ibrahim. Very interesting on the approach, how to deal with this also in an implementing way. And I understand it's been also on an organizational level a challenge to integrate this in your response and in your planning. Maybe starting from a very practical question, you mentioned that you moved to cash from your rather in-kind support before. Has this been influenced by looking for a more inclusive approach as well, or has it been just by chance parallel development as many programs in and outside Syria moved to cash in a similar period? Was this an approach to be more inclusive, which it is, I understand?
No, to be honest, it was linked to the Syrian context itself. Before, before 2-3 years ago, there was a lot of the IDPs movement and people fleeing from one area to the others. So that the assistance of the in-kind was more appropriate, especially for the emergency one. People would not have the cook facilitations in their new destination. So the in-kind was appropriate with comparing with the situation of the Syria. But after all, when the situation gets more stable and people get the returnees, return back to their areas and to their cities, the market get more function. So we as Mercy Corps, we changed our strategy and approach to become suitable and fit with the changes that has been appeared in the ground. But I linked it to the inclusion because starting to the shifting from providing the in-kind to the in-cash, as I said, comparing to the change on the ground, we discovered that as now we are taking breaths, so we discovered that there is a category of the people that we have to pay more attention to them. Before we were in a messy situation and challenging one, an emergency situation. We were not maybe focusing more or observing more about the people with disabilities. But now, after the situation get calmer more and the population gets stable, and our team gets more trained and more experience, gain more experience through our journeys. So we shifted and we focused more on the finding solutions and finding accessibilities for these people and how we improve our approach in this context.
Very interesting, and maybe taking one step back again, when all this started to move in your organization, and we hear that there has been substantial progress also on the assessment side, the registration side, etc. But at the same time, for example, in our survey in the beginning, we heard that 2/3 almost of organizations haven't made substantial progress. Could you share a bit what has been the momentum, what provided the dynamic for Mercy Corps to move in this direction? Has it been, often it's related to personal interest, to people really engaging in it, but then it relies only on this personal engagement until people move on. Sometimes it can be donor incentives. Can you share what has been the push at your end?
Yeah, as I said, the approach and many things get changed, after we get partnership with the external partners, especially with HI, and we have another partnership with MRFS, and another communication is ongoing with other agencies in north of Syria. So here, the Mercy Corps and HI approach get changed because we started a new channel, which is called referrals. So we started to get referrals from HI side with the people, the victims of blast injuries to Mercy Corps, and Mercy Corps to provide their in-cash assistance. Going back to this step back, from these steps, the tools were fit and suitable with our activities, which was not necessarily to look at the as a disaggregation of these participants. But here, after we get the referrals, we made a joint meetings to review our tools. We were not using the IASC's guidelines, but we developed another tool which is too similar to it. It is called the SADD, sex and age disaggregated data. So it was we included many questions on relating to the inclusion and to the people of the disabilities, to the age and women. And this enriched us and strengthened us to build on it.
Mm-hmm. Thank you so much, Ibrahim. Thank you for now. Now maybe we can move on to Davide Amaury, our third panelist.
Thank you.
Davide Amaury is the Deputy Manager of the Syria Cross-Border Humanitarian Fund, working for UN OCHA. And this maybe can give a very interesting example on the donor policy side, how donors can share funding, which can help on the inclusion side. At the same time, I understand, Davide, you have also interesting experience to share on the accountability side and to make people heard who we are pretending to serve sometimes. So maybe you can provide in a nutshell what this is all about in your work and related to your fund. And then we have a couple of questions for you, of course, as well. Over to you, Davide.
Thank you very much. Good day to everybody. I will speak about our experience of an inclusion pilot that we are conducting in northwest Syria with a number of partners, the clusters, and a technical working group. I will try first to give a little bit of context, how this inclusion pilot was born and how it's linked to the IASC guidelines and their implementation, actually. And then I will go a little bit more in details talking about how this pilot works. So next slide, please. Here a little bit of context. So as I said, I'm working for the Syria Cross-Border Humanitarian Fund, which is, of course, one of the country-based pool funds set up by OCHA. We all know that OCHA, that is the Office for the Coordination of Humanitarian Affairs, does a number of things, including coordination, advocacy, information management, policy reform, but also humanitarian financing. So the country-based pool fund is one of the tools, together with a central emergency fund. And I personally work in the country-based pool fund, working in Turkey to serve Syria. This fund, it's actually contributed by many donors. You see the three top donors at the end of the first slide, Germany, United Kingdom, and Norway, but we have actually this year only 12 donors. And we collected 124 million. This money, this fund is under the disponibility of the humanitarian coordinator, supported by the unit I work for, humanitarian financing unit, and allocates fund to cover gaps and humanitarian needs on the field. In our case, we work on in northwest Syria. As I said, we have collected 124 million until now in the 2021. This means that the donors trust us, but also that the needs are very high. We fund projects in all the clusters that are available in the humanitarian response to the Syrian crisis in northwest Syria. So we fund WASH, food security, shelter, health, and so on. There are 10, and we fund all of them. We fund, again, this is just the data of 2021, 56 partners for 103 projects. We have allocated 100 million. And of course, we are going to allocate more million, more money, more funding in the upcoming months. And actually right now we are very much engaged to respond to the spike in the COVID-19 cases that is happening in the last few weeks in northwest Syria. Next slide, please. So accountability, I call this slide striving for accountability. Of course, OCHA and the country-based pool fund strive for accountability, are working hand in hand with IASC committees and with the humanitarian country team. So a few years ago, OCHA introduced a common performance framework to improve management, reporting, and accountability to affected population, including a number of tools that are and indicators that are supportive of this these actions, and of course they're also used to measure the impact of the progress towards this achievement. Of course, this is in line and done in collaboration with the IASC commitment on accountability to affected population and protection from sexual exploitation and abuse, and of course also with the inclusion guidelines. Now, in 2020 in Turkey, the Humanitarian Liaison Group, which is the humanitarian country team, here as a different name, set up a group that is called AIPG, Accountability, Inclusion, SIA, and Gender and Technical Advisory Group, because they recognized the need for further guidance to come together and to guide, support, and leverage best practices in accountability framework to support the humanitarian response. Among one of these guidance, one of these recommendation was to my fund, so the Syrian Cross-Border Humanitarian Fund, to be more inclusive, to do more, to try to engage more the partners, the clusters, and all the humanitarian actors. So what we did was to conceive an inclusion pilot, to develop tools and guidance and an action plan to improve our accountability in our response, but also paving the way for a collective response. As I mentioned before, the humanitarian fund is consistent, so 124 million. So we have also the capacity to attract and fund a lot of partners, which means that whatever we do can also have an impact on the overall response. The ownership of this pilot, of course, it's under the leadership of, let's say, the Syrian Cross-Border Fund in terms of organizing, engaging, and mobilizing partners. But of course, the ownership is intended and will remain with partners, with the clusters and the humanitarian actors. Next slide, please. So we enter a little bit more into what is the pilot. In short, we call it assessing and removing barriers. Who is a part of this pilot? HFU, which is another name for a humanitarian financing unit that managed the Syria Cross-Border Fund, the Protection Working Group. Specifically, we collaborate with the Inclusion Technical Working Group under the umbrella of the AIPG that I described before. It's worth to mention that the HFU, OCHA, in this case, our fund is not a technical fund. We are a specialist in managing, let's say, the project cycle from the beginning to the end, but we will have as such a technical capacity in terms of inclusion, protection, and so on. So that's why we rely on the capacity of this technical working group. That is also one of our goal. I mean, to include, to make the best use of the resources available and improve coordination, of course. We also have involved 5 clusters: camp management and education, food security, health, and wash. You see here in the slide another 2 clusters, shelter and protection, because some of the projects are actually multi-clusters, so they're also part somehow of the pilot. And we have involved 14 NGOs, implementing partners. They're all volunteers, and they are all, of course, working inside Syria and northwest Syria. What is the goal of this pilot, of course, is ensuring more inclusive humanitarian response and promoting meaningful participation of persons with disabilities within their project, within the project cycle. We don't stop at the level of policies or standards or in any place during the conception and implementation of the project. We go from start to the end. And how it works, we try to enable implementing partners to systematically and dynamically during the project identify barriers to inclusion of persons with disabilities within their project or within their organization. Of course, together with them, of course, everybody with their own capacities and skills to develop mitigation measures within the same project. And we link this to their logical framework, to the result, to the chain of result. So for each barrier at the level of result, we try to identify a mitigation measure. And of course, what we try also to do is to continuously monitor and learn during the implementation. Of course, being this a pilot, the learning is fundamental. You see also at the end below the bottom part of the this slide that we have conceived 8 steps. Actually, we have increased by 1, the green one, and we're actually in that step. The pilot will last 1 year, so we are basically in the middle. We started with the step 1 in April. We didn't start just in any month because in April we did our first allocation. This is the mechanism that we use to allocate funding to partners. So this was the first main allocation of the years. Then during the year we do many more allocation. Sometimes they are standards or sometimes they are reserved in case of emergency, of course. And so these steps are linked to the various funding, let's say, cycle and project cycle. So they should accompany our partners throughout the phases of the project from the preparation until the end. So we foresee to end the pilot by next year in the same month. So when we will normally start a next allocation, we'll have a lot of data and we'll be able to make these tools, if it works, of course, as a fundamental part, a core part of the project cycle management from the inception until the end. Next slide, please.
Maybe quickly rushing through the final slides, please, Davide. We have to move on.
Yes. So I try to put in this slide the element of success. You see it's very much populated. Maybe it's over optimistic. And as I said, we are in the middle of the path, so we're not sure yet where we are going. But what we're trying to do was first to have this partnership and leadership. The partners, the protection working group, the cluster, SEHF, and implementing partners are all working together with the beneficiaries to make the project cycle management more inclusive. And as I said, leadership, because there are a number of leadership, inclusive leadership, everybody respecting their capacity. It's time bound, so it's linked to a project cycle. So it has to start and to end, and it has to be evaluated throughout. We started with an assessment, analysis, and training based on the people and the organization that work with us. So we didn't do anything from the sky, let's say, but we worked together with the partners to define what are their needs, what are their understanding, what are their will, what are their projects. Again, it's linked to the humanitarian project cycle. It includes monitoring, continuous monitoring, so we are able to learn as we go. Again, the learning is central, and of course, the advocacy. An evidence-based advocacy is very important. As we said, we want to make to collect evidence of how this approach can work, connect an impact on the life of people, on making the person with disabilities leaders in the project and not only beneficiaries whenever, and sometimes not even beneficiaries. So this can benefit the humanitarian response, the people with beneficiaries, and everybody at large. Thank you.
Many thanks, Davide. Probably in a year's time, it would be interesting to hear the outcome of this pilot. Maybe a quick question on the setup, talking about inclusion and local accountability to locals. Of the 14 NGOs you mentioned, how many local NGOs are involved in this, or is one of them representing also disabled people, or how did you set that up?
So as we said, the participation is on a volunteer basis, but the majority of our partners, so also the volunteers, are national NGOs. I'd say 10 out of 14. And again, in this case was more the will, so it's on a volunteer basis. Actually, we had 15 volunteers. One was lost in the process, can happen, for not linked to the pilot. So we try to be as much inclusive as possible. We cover many sectors, so of course the approach is one, but then we are learning that then the technicality is different for each project,
okay,
and sometimes for each location.
Okay, thank you. Before we move to the chat, please be reminded that we are keen to involve you. Please share questions, or as you might not have cited yet, you can also rank the questions other ones have shared. So we are sure we bring up the key questions most people are highly interested in. So take a look, please, in the F&A section or in the chat, where my colleague Ulrike will share with us in a minute what you would like to hear or to comment on. Before we do that, quickly coming back to both other two panelists, Ibrahim, maybe in a nutshell, we heard now about good ideas about this pilot on the pooled funding side. If you look back a bit on the organizational challenges on the programming side you faced, like naming quickly only maybe the 1-2 key challenges everybody should have heard, which one would be these?
So the main challenge.
Sorry, the question was for Ibrahim.
Ibrahim, sorry. Then you talk about the pilot.
Ibrahim, you could hear me?
Yes, I can. Can you repeat the question, please?
Yes,
I
please.
thought it is for David.
Quickly, Ibrahim, which 1-2 challenges would you name which you have been struggling with? What should everybody know? What has been the key challenge to move and make the progress you highlighted?
Yeah, like I think adapting the IASCs or guidance is a big challenge for us. It requires to have a right technical advisors to guide us, and absolutely it will require a budget for it as well, and requires partners and other departments buy-in to accept, to prioritize as necessity to be more inclusive at the agency, and to accept the potential consequences of this.
Mm-hmm. Many thanks, and maybe a final question from my side to Gulnaz. I hope you can hear us and it can be translated. Is that a quick question? If you reflect a bit on this accountability question, how much are you as an ambassador heard? How much are disabled people heard in this? Do you feel substantially involved, or what would need to happen to make sure on this level, for a start, inclusion is getting better? Can you give us a quick sign if you could hear us and if you are translating? We can see you, which is great, in our challenging setup to Syria and Turkey at the same time. Did my question reach you, Gulnaz?
أحد أكبر التحديات التي يواجهها هو التقليل من قدراتي من قبل أشخاص آخرين في عائلتي ومجتمعي كشخص من ذوي الإعاقة، وعلى وجه الخصوص كوني امرأة، وخاصة عندما أسمع القول إنها امرأة وذات إعاقة لا يمكنها فعل أي شيء. كنت أعاني من عدم حصول على استقلال مالي وعدم وجود إمكانية الوصول إلى جميع المرافق الاحتياجات الأساسية مثل المدارس والمستشفيات والأسواق المحلية والمواصلات العامة، إلى جانب وصمة العار المحيطة بالإعاقة. ولا يمكنني أن أنسى أنه لا يوجد أي قوانين مؤسسية مستدامة بشأن حماية الأشخاص ذوي الإعاقة التي تدعم حقوقنا كإنسان من ذوي الإعاقة.
And do you feel you are heard in all this and you are heard in your needs? Could the question be translated or?
بس يمكن إذا فيك تعيد السؤال مرة ثانية لأنه الترجمة ما كانت واضحة.
Sorry, now I could hardly hear you. The question was if you feel heard, if you feel as part of the response and heard in accountability means. Fadia, could you quickly indicate if you can hear us and translate it, or if we better move to the chat in the first place? Okay, I guess you will get similar questions from the chat, or we can come back to that in a minute. In this case, I would hand over to my colleague Ulrike. She's been monitoring the chat for us and can share with us the key questions which came up there, or the comments. Ulrike is the Inclusive Humanitarian Action Specialist of Handicap International Germany and is joining us now on this panel. Ulrike, can you unmute you so the floor is yours?
Yes, good afternoon, everyone, and thanks very much for this interesting panel. So as always, people don't believe it, but data is really sexy. So that is also testified to in our chat. And the first question came from Christina, and she was wondering whether the questions regarding who is a person with a disability, so using the Washington Group set of questions, which is a non-discriminatory way of asking that question, should be really asked to the head of household, and whether that was done based on cultural responses. And perhaps it could be interesting to put that question first also to Gulnaz and to hear her opinion. Should the head of household be asked in the Syrian context, and for all of us to keep in mind, we have a lot of female head of household, we have male head of households also in Syria, but who should this question be asked to, Gulnaz? If you could share some light of us, who should be asked? The persons, the members of the household, or the head of the household? Over to you, Gulnaz. Hoping that translation has worked.
هلا بالنسبة لأسئلة واشنطن يعني نحن راح نسألها مباشرة للشخص صاحب العلاقة لما يكون متجاوب مع الأسئلة بشكل واضح، وراح نسألها لذوي الإعاقة، يعني الشخص المرافق مع الشخص ذوي الإعاقة عندما ما يكون استجابة لأسئلة واشنطن أو فهمه لأسئلة واشنطن.
Great, thank you very much. So if I understood you correctly, Gulnaz, you say very clearly, ideally those questions should be asked to the members of the household as they are the experts of their own situation. And we have seen that also supported by Veronique from ODI, who has shared about their research in Nigeria, where they also addressed the question directly to the members of the households. We also know sometimes time constraints can limit the capacity of actors to ask questions. So in those cases, we need to be aware that we will not be able to identify all persons with disabilities. There's also guidance available on how to ask the head of household, but it's really the secondary recommended way. And we've seen that was also in the interest of Concern Worldwide, who are also in the process of changing their data collection tools. I'm also seeing a question which is related to that from Brian Reed. And he puts a more general question on the Washington Group set of questions, that it doesn't ask questions about incontinence. So that is a specific need some older persons may face, but also some persons with disabilities have specific needs related to their health condition. So perhaps a question also which we can link with another question on the distribution, which was asked to our colleague from Mercy Corps. In addition to the Washington Group set of questions, did you change other questions on how to target better persons with disabilities? Did you include also questions around barriers or specific needs, indeed, on delivery modality? Over to Ibrahim. Your mic is not on, Ibra.
Sorry. Yeah, thank you. As I said, like before, we have our own registration tool, which is consisting of sex and age disaggregated data. And as you said, like sometimes it needs a sense from the team member who is doing the interview, how to ask a specific question for the specific cases in specific context. For Mercy Corps, unfortunately, like we are not. We are asking the head of the households about the Washington Group questions, because as I said, our registration tool, it takes around 20 to 25 minutes, so it is a long time already. But sometimes we might want to think about it in the future, and we now adapted the market assessment tool, for example, and adding questions on the accessibility of the people with disability to the market. During the distribution, we are doing door-to-door distribution, and this has been asked during the registration tool, and the favorability way for such people to get the assistance. So if they prefer to receive it on their houses, so we do door-to-door, and if the distribution site is just near to their houses, we already prepare a fast lines for them.
Great, thank you very much, Ibrahim. That was a very complete answer. And perhaps, Brian, just for you also, if you want some additional tools which have been developed also by, if I'm not wrong, I think it's the University of London, around asking questions for WASH and the specific needs for people with certain health conditions, including incontinence. So there you can really find tested questions which ask those type of questions. As Ibrahim said, they also ask about specific delivery modality needs among persons with disabilities so that they can reach them directly. The Washington group set of questions is really just to identify persons with disabilities, but it doesn't look at the specific needs they may have. We have to add those questions. Great. We also had another very, very interesting question about, and it has, yeah, from Rebecca Smith. And I would like to put that question also perhaps first to Davide, as he was describing the pilot and the questions they've added. Rebecca is asking, what is being done to address stigma and discrimination due to disability in this challenging context? What could you integrate around stigma and discrimination, if anything, in the fund allocation? And afterwards, I would also like to put that question to Gulnaz. Thank you.
As initial feedback, I would say that, of course, we in all our funding, we adopt an accountability framework. So we mainstream protection, and so although we don't directly address the stigma, of course, all our means and tools and standards are, of course, aimed at have an inclusive as much as possible response. On another, and of course, whenever we assign funds, we also evaluate the projects. And it's not only us evaluating the project, but of course, it's a joint process between the clusters, the fund, and of course also the UN and NGO partners. So we are evaluate the fund, the project, each single project also under this aspect. Further to this, of course, when I spoke about the possible elements of success, is that we went to discuss with the partners. And actually was mostly our technical partners, so the inclusion working group, discussing with the partners and giving initial training, addressing, of course, also one of the stigma, how to ask questions, the Washington set of questions, and so on, understanding what was the level of understanding and the technical capacity of their partners, of our volunteers. So it's really tailored on the partners. Again, and more, after the partners came up with their proposal, because as we said, we asked the partners to go and evaluate their, assess their projects and identify barriers, and of course come up with mitigation measures. We did again the technical our technical partner individual session with each partner to discuss specifically this aspect, of course, including also how to relate and to make persons with disabilities protagonists, leaders in defining their own needs and their response to these needs. Over.
Thank you very much. And yes, accountability mechanisms are really important to pick up on discrimination faced by persons with disabilities, and I guess also the barrier question. So let's see how that will come out later on in the pilot. And I would also like to ask Gulnaz. Gulnaz, how do the ambassadors work to address discrimination and also stigma persons with disabilities may be affected by? You mentioned it's important to work at the community earlier in your presentation. Can you share a little bit whether you are able to work on that in this challenging context?
اوكي هلا انا بالنسبه لي قبل برنامج السفراء كان في كثير شغلات ما اعرفها عن شخص ذوي الاعاقه، مثل حقوق ذوي الاعاقه ما كان عندي معرفه فيهم. بالنسبه للمجتمع انه شلون انا بدي اتعامل معهم، بس بعد ما عرفت برنامج السفير وصرت من احد سفرائها، صرت اعرف انه شخص ذوي الاعاقه عنده حق مثل اي شخص ثاني بالمجتمع. فصار فيني أخذت قوة من برنامج السفير وصرت عم بنزل بين المجتمع عم بدافع عن حق من حقوقي، وهو إنه أنا كشخص مثلي مثل أي شخص ثاني بالمجتمع. فصار نوع من صار بالنسبة لي بالبرنامج السفير هو جلسات توعية أكثر شيء، توعية ذوي الإعاقة على معرفة حقوقهم.
Ulrike, would you have a final question to share? After that, I think we really have to conclude.
No, I think it was the very important point to hear that even in this challenging context, Goldness and the other advocates are able to work also on discrimination, and barrier-related questions can really help us to identify also actual and factual discrimination. So it's really important. And the other questions, I hope we can link up and answer in writing. So apologies if we didn't manage to answer everything. Over and back to you, Ralph.
Many thanks, Ulrike. We will also bring in the audience by another question in our survey, which we would like to share in a minute. And after that, I would give the floor for please 1 minute to all our 3 panelists to comment on the survey result and anything else you would like to quickly share. But maybe in the first place, we would be keen to ask you another question related to the discussion, but also if you could share a realistic outlook with us, referring to your organization or the ones you are working with or you know more about. What is your outlook for the future of inclusive humanitarian action? How will your organization position in the next, let's say, 2 years when we have another 2 years with the guidelines in practice? Will you substantially increase the engagement and resources related to that, like staffing, financial resources, time? Will you increase engagement and resources to some extent, maybe? Will you maintain the engagement and the resources on the level right now? Will you decrease rather engagement and resources, maybe because you are lacking funds? Or is there no engagement and you don't realistically expect your organization to engage? If you could give an anonymous but very honest outlook to us so we know what's going to come and how to deal with it. Hopefully, maybe another 10 seconds for that, and then we'll be keen to see the results. If we could finish the survey right now and colleagues could share the outcome with us. So we have a substantial increase by maybe 13% of the colleagues engaging, an increase to some extent by surely encouraging 79%. And it might remain on the level it is right now, the minority of 8%. Nobody expecting that this could be an issue in times of saving resources and cutting budgets to be hit, which is surely good news. But with that, I mean, if I might move back to Goldness in the first place, if you see the outcome of this survey, is this encouraging, or would you have hoped for more, as there is so much which still needs to be done?
هلا بالنسبة لهالسؤال هو لازم يكون جهود أكثر بالنسبة لأشخاص ذوي الإعاقة في المجتمع، يعني إنه المشكلة ما رح تنحل بين يوم ويومين مثلا، فهو لازم يكون مشروع على مدى سنوات يمكن، لأنه في مجتمعات عندنا ما عندهم علم أبدا بحقوق أشخاص ذوي الإعاقة بالمجتمع. فأنا واحدة من الناس عانيت كثير من هالمشكلة، إنه كيف أنا بدي أخلي العالم بالمجتمع تتقبلني كشخص ذوي إعاقة. فصرت اشتغل مع برنامج السفير لأثبت للعالم إنه أنا شخص ذوي إعاقة، بس إلي قدرة إنه اشتغل، أعمل، أطلع، كوني أنا وزوجي من أشخاص ذوي إعاقة، فلازم نكون أشخاص بالمجتمع أشخاص متساوون مثلي مثل غيري، فهو مشروع لازم يكون مشروع مستمر.
Thank you. Thanks so much, and thanks for joining us today. Ibrahim, what are your views? Is that a good result, or would you have hoped for much more?
Yeah, as I said, like the inclusion is a new topic, and it is a daily experience learning for the agencies working in NES of Syria. Not even like the people with disabilities, but all the marginalized groups as well. So many agencies are investigating, planning to invest more and more in inclusion. But as I said, it is not an easy process, and it is on daily basic learnings as well. For Mercy Corps, like we have started inclusion and getting referrals on the people with disabilities from HI and even from the health committee at the same time, and working with the health committees, which is linked to the bodies or for the local authorities in the areas that we are working. It was something new for them as well. Imagine with me, like living in a context like Syria, the more attention for the local authorities, the priorities, it was different from what we asked them to intervene. When we asked them about dealing and supporting these kind of the people, they were not ready even like to have the registration lists for such of the people. We already knew that more than 20% of the Syrian population and the area we are working in, they are containing of the people with disabilities. So this showed to them like to focus more on this, and then we work together. But as I said again, it is a daily learning experience learning.
Mm-hmm. Thank you, Ibrahim, and many thanks for joining us today from Raqqa. Davide, any comment on this figures and the outlook, which role inclusion might play in the overall humanitarian response in future?
Yeah, I would focus on the resources. SCHF is not a donor, but we work somehow, and we are seen as a donor. And actually, we see from a deeper perspective, because whenever we receive project, we see that the funding, the resources requested for the quality intervention, for the accountability, and of course also inclusion and so on, is not so in line with what the partner say that they will do. So it's my smaller recommendation: don't be shy, donors, and because we talk to donors continuously. If you present a strategy, if you present a plan to develop your capacity, and if you present also an adequate resource planning, we will not shy away from funding it. We're actually waiting for these proposals because we are happy to do it. We have commitments, and we know that, of course, commitments needs to invest some resources, but we are really ready to do it. So please come forward.
Many thanks, Davide, for these final encouraging words. We heard, I believe, that there is much more to do. We heard a lot of examples and ideas how to make progress and to learn from each other. For me, there's only left to share with you that there is much more information which can be made use of, for example, of the website of Handicap International, which is shared again in a second. We will share the outcome of this panel by the mentioned graphic recording, which has been painted in parallel, and a recording of this whole session will be shared as well. For us, it has been an interesting learning exercise. I hope it has been interesting, and I hope it has been really fully accessible to everybody. Otherwise, please let us know, as we are here also to learn to act as inclusive as possible, and we have to learn on this as well. Having said that, I hope you could take something out of this event. Many thanks again to Handicap International hosting this together with us, and to the German Foreign Office funding it. Please stay tuned, and we will surely come back to this important topic. Many thanks to all three panelists. Many thanks to Gaziantep, to Raqqa, to Northeast Syria, to Wilnap, and for the translators doing a great job. Many thanks to everybody. Have a good afternoon and evening. Bye-bye.
Goodbye.
Goodbye. Thank you.